Hi everybody, let's talk about AccuVein Vein Finders. This video is a bit longer, but I think most people who watch this are going to learn at least one new thing. First, let's talk about how far you need to hold it. You want to hold the AccuVein about 6 to 10 inches away from the skin, and the easiest way to do that is to use the vein finder as a measuring stick since it's about 7 inches long. You also want your light display to be about a 3 inch by 3 inch square on the skin. Vein finders typically have two settings. The left button allows you to toggle between the light settings, and the first one displayed here is where the veins are shown as a bright light, almost like lava flow. And the second setting is inverted, making the veins dark and the surrounding tissue bright. There is no right or wrong setting. Just toggle both displays to see which gives you a better visualization of the veins. In here I switch it again so you can see the difference between inverting the light, and I'm also playing with the middle or second button, which is the brightness setting. There are 3 brightness settings: low, normal, and high. And you can see me toggle through these. Adjust it as you need to. The third button on the vein finder is the auto shut off timer. You can set it to the infinity setting, which means it will never turn off, or keep pressing it to change your auto timer to power it off as needed. It's usually set for 10 minutes. Keep in mind, most people only use the vein finder for the insertion of an IV. However, it's also a great assessment tool, as you can see as I drain the blood in the vein to identify a valve and then release the pressure to allow the vein to refill. It doesn't only show me where the valve is located to avoid it, but it also shows me the speed at which the vein refills, which can be an indication of the patency of the vein. You want to choose a vein with quick refill versus a vein with slow and sluggish refill. You can even mark the location of the valve if you see one, just to be sure to avoid it by inserting just above it or inserting far enough below it that when you thread the catheter, it won't reach the valve. This helps with better fluid flow and also reduces the chance of intraluminal damage. Another great use for the vein finder is to ensure that you are within the vein. As you flush the vein, you should be able to visualize the blood being displaced by saline, providing verification that you are inside the vein. To maximize the clarity when performing your insertion, you should align the edge of the green box with the point of your needle. This helps to prevent the IV needle from interfering with the vein visualization, and it also allows for easier visualization of flashback, as the flashback chamber will typically be outside the illumination box. You're welcome to insert inside the box, but just keep in mind it might cause some refraction and interference with the visualization of the vein. Superficial veins will have a clear, crisp, and dark, depending on the setting that you have, appearance. Decreased image sharpness, pixelization on the surface of the skin, or fuzziness is an indicator of adipose tissue or that the vein is deeper, but not necessarily an indication of a poor quality vein. It's just a bit deeper. Keep in mind, vein finders can only see veins up to about 10 millimeters or 1 centimeter into the tissue. And if you can't see any veins while using the vein finder, that means there are no superficial veins. And this patient is probably a really hard stick, and you might need to use ultrasound if you can before blindly attempting. Vein finders typically don't work well over tattoos, as the ink tends to interfere with the illumination of the veins. Also, if the patient has hairy arms, it can project a lot of shadows and interference. You can simply take a moist towel to mat the hair down to create a clearer image. However, I found that a hair trimmer is much more effective than simply matting down the hair. And I just want to emphasize this is a hair trimmer, not a razor shaver, as those actually increase the risk of infection. The laser is also safe if it gets exposed to your eyes or the patient's eyes, so no need to panic if there's a quick, unintended exposure as you're scanning. When you're done, you can clean the entire vein finder with purple sanding wipes, but these can sometimes leave a residue on the reflection mirror and scanning glass underneath the device when it dries, which can affect the functionality. And that's it. Hopefully you learned something and you feel more confident using the vein finder. It's a great tool.